Hi guys, my name is Olivia Pennington. This is my patient Lindsay. Today I'm going to be performing a cardiovascular and pulmonary assessment on her. And so first I'm going to go ahead and look at her shoulders, and they are even and symmetrical, and her abdominal muscles look like they're holding her up and doing their job and appropriate for her age. And so now I'm going to palpate. Do you feel any tenderness? No? Okay. And I felt no masses, so that's good. Go ahead and take a deep breath for me. Perfect. And so her chest does expand symmetrically. And so now I'm going to do the tactile firmitis test. So every time I touch down, just go ahead and say 99.
99, 99, 99.
Perfect. And so on that test, I was looking for equal vibrations on each side, and that was present on her, so that is a great finding. So now I'm going to go ahead and listen to her breath sounds in the front. Go ahead and take a deep breath every time I push. Go ahead and lift up your chest for me. All right, so her breath sounds were equal and clear bilaterally, and her thoracic cage is intact. No broken ribs, everything looks great. And then her intercostal spaces all have even amount of space in between. So now I'm going to have Lindsay go ahead and turn around for me so we can take a look at her back. And so once again, we're going to go ahead and look at her shoulders. And her shoulders are even and symmetrical, which is great. Her spine is midline in her back. Another great finding. And then, Lindsay, I'm going to have you go ahead and take a deep breath for me. Perfect. And so her chest does rise symmetrically and expand, and it's a good finding. So now I'm going to go ahead and listen to Lindsay's chest or back breath sounds. Go ahead and take a deep breath. Perfect. And so her breath sounds were equal bilaterally and clear. So now I'm going to check, I'm going to do percussion on her back, and I'm going to listen for resonance. And so on those lower two is where I heard the difference, and that's a good finding as well. And so next, I'm going to go ahead and do the whisper pectoriliquy. And so Lindsay's going to go ahead and whisper 1, 2, 3, and I should not hear anything. So go ahead and whisper 1, 2, 3 whenever. And then, so next I'm going to go ahead and do the bronchophony. And so for this test, she is going to say 99, and I should be hearing muffled breath sounds. And go whenever you're ready.
99, 99, 99, 99, 99, 99.
Perfect. And so those were muffled. And the last test that we're going to do is the egophony. And so this one, she's just going to say E, 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 and I should hear that pretty clear.
E, 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 E.
And so if I were to hear A on that, then that's when we would kind of look more into it and feel like there was something wrong, but I did hear E on all of that. So that is another great finding. And that is all we're going to do on your back. So I'm going to have you go ahead and turn around. And so now I'm going to go ahead and listen to Lindsay's heart. And so I'm going to listen at the second intercostal space, right sternal border, the left intercostal space, the second intercostal space, left sternal border, and those are the aortic and pulmonic. So the aortic is on the right side, the pulmonic is on the left, and then I'm going to hear at the third and fourth intercostal space, and that is the Erb's point on the left sternal border. And then I'm going to listen at the fifth intercostal space, which is like the apex of the heart. I can go ahead and have you lift up your chest. Thank you. Perfect. And so all of her heart sounds were present. And so now I'm going to go ahead and count her apical pulse for 1 minute. So Lindsay's heart rate is 74 beats per minute, and she was in normal sinus rhythm, so that's good. And I'm also going to go ahead and listen with the smaller side of my stethoscope to her heart sounds really quick. Go ahead and lift up for me. Perfect. And so then now I'm going to palpate her carotid artery. Her pulse is normal, which is typically like 2+. And then now I'm going to auscultate her carotid artery. And everything sounds great. Thank you.